My name is Amanda, and I'm a child life specialist in the radiology department at Cincinnati Children's Hospital. I always knew I wanted to work with children, and when I found out about child life, which is working with children specifically in a healthcare setting, I knew that's exactly what I wanted to do. Working as a child life specialist in the radiology department, I get to work with children and their families when they come to radiology for various tests and procedures and help them learn about what's going to be happening while they're here, as well as help them cope with the experience. So it may be something that they have to hold still for while we take images, and so I can help to explain to them what the camera is going to be like and how important it is that we need them to be still. We offer things such as movie goggles as a way to keep their attention and help them to be able to be successful in completing their scans. We also do some various tests that involve needles and IVs and different more painful or invasive procedures, and so part of my role is to help them understand what we have to do. I use a lot of play in my job to show young children about the materials that we're going to use to help them really be able to successfully cope with the experience. We always encourage parents to be really close to their children during these kinds of appointments, so I can help to model for parents where's the most appropriate place to stand for a procedure, how they can help best comfort and support their child. It can be scary and intimidating for children to be here at the hospital, and so another part of my job is to really help normalize the environment. So we'll use some play and conversation to really help them feel more comfortable here. There are 3 child life specialists that work here at the base radiology campus, and we work together to support patients and families for various procedures and appointments while they're here. You can always ask to work with a child life specialist when you're here, but we also really work to prioritize patients that may be more vulnerable and that may need our support the most. I love working in the radiology department at Cincinnati Children's. I work with a great team of people from various disciplines, from doctors to nurses to imaging technologists, and we all work together to try to make this experience as easy for children and their families as we can.